A very good evening, everyone. A very warm welcome to all our Vidya students, mentors, and well-wishers. On behalf of the entire Vidya family, our team, mentors, and dear students, it's my great honor and privilege to extend a very warm welcome to our distinguished speaker for today, Professor Dr. Arvind Rao from the University of Michigan. Welcome you, sir.
Thank you, madam.
We are truly delighted and grateful that you have joined us for our Dream, Dare, Do webinar series, a platform where we bring inspiring leaders and innovators to ignite young minds and encourage them to think beyond limitations. Dr. Arvind Rao is an internationally respected scholar, researcher, and innovator working at the powerful intersection of computational medicine, bioinformatics, and radiation oncology. He serves as a professor at the University of Michigan, Ann Arbor, one of the world's leading research institutions. His work beautifully integrates advanced data science, artificial intelligence, and medical imaging to deepen our understanding of disease and enhance clinical decision making. What makes Dr. Rao's journey particularly inspiring is his commitment to bridging disciplines. In today's world, breakthroughs rarely happen in isolation. They happen when medicine meets engineering, when biology meets data science, and when curiosity meets courage. Dr. Rao's research focuses on integrating diverse biomedical data from genetic information to complex medical images and transforming them into meaningful insights. These insights help improve how we detect, understand, and treat complex health challenges, especially cancer. Through his pioneering work, Dr. Rao demonstrates how innovation is not merely about technology, but about solving real human problems. His contributions have earned him global recognition in both academic and research communities, and more importantly, they continue to impact lives. For our students at Vidya, this interaction is extremely significant. Many of you come from diverse academic backgrounds, commerce, science, engineering, arts, and you may sometimes wonder how your field connects to larger global challenges. Dr. Rao's journey reminds us that innovation begins with curiosity. It begins with asking simple questions. It begins with observing problems around us and daring to imagine solutions. Today's session, titled From Curiosity to Innovation, AI in Healthcare, perfectly aligns with the Vidya spirit of dream, dare, do. Dream, because every breakthrough begins with a vision. Dare, because stepping into new domains like artificial intelligence requires courage. Do, because innovation ultimately demands action. This session is a valuable opportunity for our students to understand how complex real world healthcare challenges can be broken down into beginner friendly ideas. Artificial intelligence may sound like an advanced or intimidating field, but today we will learn how students from different disciplines can begin exploring it meaningfully. We'll understand how observation can lead to innovation, how interdisciplinary thinking can create impact, and how young minds can prepare themselves to contribute to the future of healthcare technology. In a rapidly evolving world, the ability to connect knowledge across domains is becoming one of the most important skills. Dr. Rao's work exemplifies this integration, combining medicine, engineering, analytics, and compassion to create solutions that matter. We are deeply inspired and humbled that he has taken time from his busy academic and research commitments to engage with our Vidya students and team and also encourage them to think boldly about the future. Sir, it's truly an honor to have you with us today. We look forward to learning from your insights, your experiences, and your journey from curiosity to innovation. With great respect and enthusiasm, I now invite Professor Dr. Arvind Rao to address the webinar. Thank you so much, sir.
Thank you, Nandini, madam. Really appreciate the kind introduction and the opportunity to talk to all the students today. I come from an engineering background, and I had put together a lot of slides, but the intent is not to go through each slide in great detail. It's mostly to be able to start a conversation. And so I'm not looking to get through all the slides in the next 30 minutes, but I'll also kind of zoom through some stuff so that at least we get a broad sense of what we're talking about today, so that we have perhaps a few more avenues to talk about during the Q&A. All right. So with that as the a backdrop, let me just get to share my slides. And share. Yes, slides. Let me know if you can see the slides. Okay, great. I'm guessing you can now see the slides, correct?
Yes, sir. We can see the slides.
Perfect. Perfect. So this is sort of using the a broad umbrella, which I think intersects technology, social sciences, and the idea of being humans in a very complex society. I'm hoping to talk about AI ethics for healthcare as one use case. Hopefully, it will prompt other questions to you. Now, this is work that is done in collaboration with Achyuta Rao, who is a student in Ohana in Bangalore and also in A2 Virtual in Ann Arbor. And so this is basically our combined effort to present this work. And for the people who are just interested where I'm coming from, I'm an engineer by training. I got my degree in Bangalore. I then went to Texas in the US to be able to get my, excuse me, to get my master's degree. And then I went to Michigan, which is the north part of the country, just south of Canada, to be able to do my PhD. And then I went to a place called Pittsburgh in Pennsylvania to do a short postdoc in computational biology. And then I started my faculty journey first in Texas and then in Michigan. And so what I wanted to take the first couple of minutes to talk about, I've got my phone here in my hand. I'm going to try and experiment with all of you, which is that there's this app. I don't know how clearly you can see it. It's got a heart on it. And it's basically a way to be able to, it's an app on the phone to do the following, and hopefully it'll become clear what it does. It's a free app, so there are ads that I have to skip. Give me just a minute.
Sure, sir.
Hopefully it will get to the app. So okay. So the app looks a little bit like this when I open it. It's this bar here says measure now, and then you can see the heart app here. The idea is it will help me measure my heart rate in the following way. So I hit this button says measure now. When I hit measure now, this flashlight on the back illuminates. It then wants me to put my fingertip on the camera, and then it starts counting my beats per minute. It's not super clear, I apologize, but it's hopefully showing you what's going on, a little bit at least. It'll now beep once it's done. So it gave me a tick mark, it gave me a beep, and it said that my heart rate is 86 beats per minute and I am under 17% stress, right? Whatever that means, right? Maybe my heart rate normally is quite high, so 86 is not a big number. On the other hand, if my heart rate is 72, then 86 is a big number. So it helps me to monitor my heart rate and then measure my stress. So what just happened here? A few things happened. The source of the signal to make the heart rate measurement was not some ECG on my chest. It was just my fingertip. Then I used my fingertip as an input to this standard flashlight based camera on my phone. I have an Android phone here, which is actually quite old. It's not even a new it's not a new model. So I put my fingertip on the camera. I waited for about 30 seconds and it read the signal from my fingertip. We'll talk a little bit about that. And then made a measurement. And that measurement was then converted through an algorithm to report my heart rate, right? So what happened with 3 blocks, right? Input, which is my finger, model, which is the exercise of taking the signal from my fingertip, converting it into a heart rate, and the output was this heart rate, right? It's pretty amazing if you think about it, right? It just used my fingertip signal to be able to assess my heart rate. And how did it do that? This is actually a concept called photoplethysmography. It's called PPG. And the idea is fairly simple. What it does is, as my heart is beating, the blood is moving around in my body, and so at my fingertips there is blood flow as well. But imagine like a pump. Every time my heart pumps, there is a bit of a ejection of blood through my fingertip. And when I put my fingertip against the phone sensor, the camera, this light is slightly diffracted. Okay, it's slightly shifted. And it uses the shifting of the light as being read from my fingertip to be able to assess how fast my heart is pumping. It is pretty amazing. It can do that, right? And this is completely non-invasive. I didn't have to go to a doctor. I'm at home. I didn't have to have, 16 or 12 ECG leads put on my chest. I'm talking to all of you. I can do this thing while I'm talking, right? So look at the comfort, right? Now, what's going on? There are multiple steps here, right? Like I used a few words now. I used the word like input, which is my fingertip. I used the word like model, which is the brain of the algorithm on the computer, on this phone, right? There's a computer, there's a algorithm running on this chip that processes this incoming data from my fingertip and outputs the heart rate. This model that's living on the computer chip could be an AI algorithm. It could be a signal processing algorithm. It could be anything. It's got some intelligence, right? Not in the sense of human intelligence, but it's got some machine intelligence. And it can use this intelligence, if it's properly coded through programming, to be able to go from the signal from my fingertip to the output of my heart rate. People can use a variety of technologies to do this kind of processing. You could use, conventional light, refraction, diffraction principles. You could use optical signal processing. You could use AI. So AI is just one more in the gamut of methodologies available these days to be able to make sense of data. But the key part is the word sense, which means once the AI algorithm does its job on the data that's incoming, the human being then needs to make sense of it. When I look at this heart rate and it says 86 beats per minute, like I said, if 86 beats per minute is my usual heart rate, I wouldn't be concerned, right? But if it is an elevated heart rate, the first question to ask is, well, why should I have an elevated heart rate? Maybe I'm nervous that I'm speaking to so many young, bright kids, so I'm a little bit nervous, right? So my heart rate is a little bit elevated. That's one explanation. The other explanation is maybe my heart is not feeling so good, which is definitely a cause for concern. I need to go talk to a doctor and say, look, doctor, my typical heart rate is 72. I'm at 86. And it's something I want to at least get checked into. So this is information I can then use to make sense of my body, to make sense of my physiology. And so this example is one among many examples where one can use AI-like algorithms to make sense of data. There's nothing special about AI per se. To me, AI is a general broad purpose term that is used to describe the kinds of things you can do with data, right? So let's not, we can talk a little bit more in the question and answer session about, what AI might entail specifically. There's a lot of conversation about it. You have all been reading articles in newspapers and hearing about it on TV. In fact, right now in Delhi, there is a week-long AI summit that's happening. It's, I think, ending today or tomorrow, right? Lots of interesting conversations are happening. But now the question is, with AI being such a prominent conversation in this country or across the world, what does it mean for us as citizens who want to be able to use it for the benefit of humankind, right? So this is, I guess, a good example of AI because you're using it to help people understand their health. But not everything is the same way, and we'll talk a little bit about that. So, like I said, this is a great technology because it's non-invasive. There's no pin pricking. There is nothing. It's very painless. It's real time because I get a very quick and very good sense of what my heart rate is like, and it's accessible to everyone. All I need is a cell phone. Okay. And so a cell phone is available to a lot of people. So installing this app and making it work is pretty easy. All right. Then comes the other question. Because it's on a smartphone, a lot of people can use it. But what now? I wanted to maybe take a minute if somebody wants to volunteer. This is one cell phone. This is from Samsung. It's an old model of Samsung. And this app is installed on a Samsung phone that I'm using. Somebody else might have an iPhone. Somebody else might have a older or a newer model of a Samsung phone. When one has this kind of variability between different phones, do you expect that the results from this algorithm on the different phones should give the same result? I know we are all on mute, so let me try a different experiment. How many of you think that when you change the phone, the result from this algorithm is going to be the same? If you feel that it's going to be the same, raise your hands. How many of you feel the result is going to be the same even if you change the phone? Anybody, if you feel that way, raise your hands. Okay, the few cameras that are on, let me take a quick look. Anybody raising your hands? I don't see any hands raised. So most of you are probably appreciating the fact that when you change the phone, there's going to be a systematic variation, right? Everybody's camera is different. Everybody's phone model is different. A lot of variabilities from device to device that might make it very difficult to make this algorithm generalizable. Okay, so there are challenges, and one has to be able to understand these challenges to then be able to correct it so that you can get a reliable reading, because reliability is everything in health. If your reading is not reliable, you are likely to make mistakes. Just to make sure, am I audible? Am I making sense? Would you like me to shift to a different language, perhaps Hindi? Would that help you? Or would you prefer me to continue in English? What would you prefer?
Sir, this works fine. I think the voice is very clear and audible. The language is also perfect for everyone.
Okay,
I think you
good.
can continue with this.
All right, great.
Thank you, sir.
Thank you. So, like I said, when you talk about using an AI app on a phone for healthcare, safety and reliability are critical. What do I mean by safety? It shouldn't give me a reading that is too low. Let's say I'm having a heart attack and my heart rate is very high. I don't want this thing to make a mistake and say everything is perfect, because that means it's not reliable. It's not safe, right? So these are things to think about when you want to bring AI to work for human betterment, right? Like I tell people, right? You all are using AI as part of shopping on Amazon or watching movies on Netflix or wherever it is, or Amazon Prime, right? And you are seeing an AI algorithm recommend movies to you to watch. When you go to YouTube, the algorithm is engineered such that when you watch one video, it will recommend the next video for you to watch because it is trying to learn your preferences. But in YouTube, if I recommend the wrong video for you to watch, it may not be a good video, it might not be a good content, but it is not invasive, right? But in medicine, if I gave the wrong medicine to a person using AI, it is very difficult to reverse that because that medicine could be poison for that patient. So it's very important to understand that in medical care, AI has to be used very responsibly. Okay. The other thing that matters is that we have to keep people's data private. If I found out that some student here, maybe their name is Anita. Anita is watching, I don't know, a movie called Circus. If I got to know about that, yes, it is an invasion of Anita's privacy because now I know what movies she is watching. But arguably, that's one level of privacy, right? But if I get to know Anita's health conditions that she may not want others to know, right? We have to be very careful that this phone app that she is using doesn't just send her data to the whole world. So privacy is very important. The other thing is, in healthcare at least, there is no room for mistakes. Even a small mistake has to be reported and fixed. So we need to have a mechanism to provide continuous feedback to the app developer in case mistakes are happening so that they can fix it. And that also means you need to update the app regularly. Now, we talked about failure modes, what can go wrong. We talked about reliability. We talked about safety. But let me ask you one thing that, I don't know, anybody, if you have students today in Bangalore, but I'm in Bangalore as well. If I ask you the temperature in Bangalore, there are three ways to answer this question. The first way is, let's say when you walked into the school in the morning, it was about 28 degrees in the morning. So you said, well, things don't change that much. It was 28 degrees in the morning. Now it's afternoon. It will be hotter. So maybe it's 30. Right? That's a fair assumption. The other way to answer this question is that somebody goes out, opens the window, looks outside, feels the hot air on their face and says, it's 30 degrees. That's a little bit more data. The third is somebody again uses a phone app for weather where the INSAT satellite information is available and it says in Bangalore at 3 o'clock, the temperature is 30 degrees. All the three answers were the same. Everybody, the first person who had the least information also said 30 based on a guess. The second person, a little bit more information, but they also said 30. And the last person had the most amount of information and also said 30. So if they were AI algorithms, the AI algorithms are all agreeing by saying that their temperature is 30. But what is different between them? What is different is the confidence with which the answer is given. The person that guessed had the least confidence because they had not looked out the window. They didn't have an app to check the temperature. They just were lucky to be correct, right? Whereas the second person had a little bit more data, so their confidence was slightly better. And the third person had a weather app. And because they had the most up-to-date information, their confidence was the highest. The opposite of confidence is uncertainty. So it's very important to quantify what is your uncertainty when you make a measurement, right? I'll give you another example. Let's say I'm having very bad cough and very, very bad, sinus, and I don't know, but I'm suspecting I have COVID. So I ask my mother, for example, and say, I think I might have COVID. So she looks at my temperature, she says, yeah, given your symptoms, you likely have COVID. But my mother is not a doctor, right? She's an intelligent person, but she's not a doctor. Now I go to a doctor and they also say you might have COVID. So the answer from both of these people was the same, that I might have COVID. But the doctor had more confidence and less uncertainty. And in healthcare, uncertainty matters a lot. That's why we go to doctors, we go to specialists to get a second opinion. So in healthcare, uncertainty is very important. Now, one more thing I want to mention before I go to the next step is that what else could have changed when I took this AI algorithm, right? Maybe some people have very small fingertips, so it doesn't cover the full camera. Other people might have very low battery on their camera, so the flashlight doesn't light up with the same intensity. Somebody else might be doing this experiment in the rain, in which case there's going to be a problem too. So all of these factors are called edge cases. These are things that can adversely affect the quality of the AI output because it's not ideal conditions. So that's something called edge cases. Now we have talked about a few things. We talked about input, model, algorithm, output. We talked about safety, reliability. We talked about edge cases. We talked about uncertainty. Okay, all of these concepts are concepts that you need to think about as innovators for healthcare. Tomorrow you build your own app on a phone. You need to remember that because it is being used to help or guide somebody, there is very little room for mistakes. Because if somebody makes a incorrect assessment based on the wrong output from your algorithm, it can be very, very harmful for them. So I've already talked about this. Now I'm going to shift gears to a slightly different problem, right? Which is that AI has also become very popular in the past few years because the Nobel Prize in 2024, both in physics and in chemistry, went to AI, right? Which means for the first time, AI was able to play a very important role in scientific discovery. So people believe that AI can solve lots of problems. But the question is, are we there yet? One more group feels that AI can act as very good doctors because AI can pass, like you might have heard of ChatGPT, you might have heard of Claude, you might have heard of Perplexity. These are different models that are available these days on the internet that you can use to do AI. And people have shown that these models can pass medical exams, which means whatever exams the doctors write to become a doctor, AI can write those exams equally well and pass with flying colors. But just because you can pass an exam, does it mean you can practice like a doctor? Right? That's very different, right? But people are very quick to jump to the conclusion that we can actually have AI replace doctors. So I did a small experiment a few months ago. I said, I'm sorry that you may not be able to see my screen very clearly, but I will read it out for you so it is clear. I gave a talk about AI to some school students like yourself about a year ago. And one student raised their hands and said, well, if AI is so nice, can I use it to do my homework? It's a very good question. And I didn't want to discourage the child, but I said, let's ask a very simple question to AI and see how it does. So I did this experiment in January of 2025, last January. I did it in February. I did it in October last year. I did it in January again this year. And somebody else did this experiment for me in February. So almost 5 times this experiment has been done. And the answer is surprisingly still the same. So I tell you what the answer is. I asked a question, how many letter S in the word strawberries? The right answer is 2. But the algorithm very confidently says there are 3 S's in the word strawberries. Then I asked the AI, you said there are 3 S's in the word strawberries. Can you give me a logic and process? And it gives me great logic, wrong logic, why there are 3 S's in strawberries. It still didn't pick up its mistake. Then I said, are you sure? And then it checked again and said, yes, after reviewing it carefully, there are only 2 S's in the word strawberries. Thank you for pointing that out. So AI can make mistakes, right? If it's counting number of letters in a word like strawberries, nothing much is lost, right? That's okay. But if I'm COVID positive and you call me COVID negative, and you say I don't have COVID, I will go out into the world, do my things, and I might end up infecting a lot of people, right? That's a risk I cannot reverse. So it's very important to understand that in healthcare, errors can have serious consequences. And when AI can't even solve a simple problem like this, how much can you trust the AI for more serious tasks? I will ask you one more question. You might have seen this. is AI is incapable of saying, I don't know. When you use ChatGPT, have you ever got an answer that says, I don't know from ChatGPT? I doubt it. You always get some answer back. But just because you get some answer back, does it mean it's correct? I don't have time to get into this video. If I do, maybe I'll show you later. But it's a beautiful set of videos on YouTube. You can take a look. The links are both here, right? This is when two AI agents, just imagine I have one phone, I have ChatGPT on this phone. And another phone also has ChatGPT. What happens when these two phones start talking to each other? So this is called AI communication, right? When one AI talks to another AI. And what can happen? It turns out that when two AIs talk to each other, sometimes they can change their language of communication so that the human doesn't even know what's going on. And that can be very dangerous because an AI can do things that a human is not able to anticipate. Okay. And this is not new. There have been stories about, what is called agentic misalignment, where the AI doesn't do what it's supposed to do for humankind. There's also an example where somebody tried to shut the AI off and the AI threatened with blackmail and said, if you do this to me, if you shut me down, I will do something bad like putting all your email on the internet. So the AI kind of reacted to the human's intention to fix it. When we can't fix these things, are we ready to work with them? That's a question that you have to ask. Yet, people are building algorithms for medicine. People are building algorithms for science. And some people believe that AI can actually be a doctor. And the question I want to leave you with is, given all these errors that are possible, how reasonable is it to imagine that AI can be a good doctor at this point? I doubt it, right? And since you're students, I will show you this little cartoon from Spider-Man, right? There's a very famous sentence that says, with great power comes great responsibility. So AI is like that superpower. But you also need to have the responsibility to be able to use it well. Otherwise, there can be some very, very big problems. So how do we solve this problem? We solve this problem by bringing multiple people and discussing among them. We educate the whole community to think about AI in a responsible way. Not just the AI programmer, not just the phone manufacturer. Everybody should be thinking about at least how to make sense of AI. Just because one person says AI is great doesn't mean we should believe them. We should use our own mind and critical thinking to be able to understand. Let me tell you, if the AI manufacturer cannot convince you, school students, that AI is good, you should trust your instinct. Because if they can't convince school students, then maybe they're not ready to solve real problems. Because school students are very inquisitive, they are very intelligent, they are very, very careful. So the only answer to this, like I said, is education. I'm not saying everybody needs to become an AI programmer, no. But everybody needs to understand what AI can or cannot do so we can use it well. So tomorrow when your grandmother or your grandfather or uncle says, I used AI to get this answer, you should be able to tell them, how did you check your answer? Don't believe everything AI says because it could be wrong. And he doesn't even know that it could be wrong. So the answer is education. There's a beautiful course on the Government of India called AI for All. It's a free course. It's about 6 hours in length. You can do this course online and you can get a certificate. It's a very exciting time to be able to think about AI education. And similarly, in the new standards education program, now there's AI in CBSE and a lot of boards are beginning to think about AI. So with that said, I will close. Thank you very much for your attention and engagement. I want to thank a few people, IEEE, ASA, Triple AS, all of whom I work with closely so that we can actually make sure that the community at large is educated and informed and able to clear about what AI can or cannot do. Because I think it will need people. You are the innovators of tomorrow. If I can communicate to you that these problems can exist, I'm sure India and the world at large will be in a better place. Okay. With that, I'll close. I'm happy to take any questions.
Thank you so much, Dr. Rao.
Thank
That
you.
was quite interesting, interactive, and enriching session from your side. We really like the concepts, especially aligning with the recent current technology and development. I'm sure students would have listened it with rapt attention. And now I open the floor for question and answer. And students, I encourage you to actively participate and make the most of this opportunity by asking your thoughtful questions to Professor Dr. Arvind Rao. So first, I now call upon Preetham to ask his question to sir.
Good evening, sir.
Good evening.
I am Pritaman, first year engineering student from Vidya Scholarship Program. Before asking my question, I actually thank you for this beautiful session. My
Thank you.
question is, when we see a big problem, how do we break it down into smaller, manageable steps so that students like me can start working on the problem?
It's a great question. So, I have two answers, but I will say this, that the best way, everything to solve the problem you already have. You don't need to learn technology to solve the problem. What I believe is, if you can educate, let's say you find a colleague, let's say another classmate, and you say, here's the problem. How is the simplest way to solve that problem? Right? Let's start simple. If we remove all the unnecessary stuff. So removing the noise and only focusing on the part that matters is one way to get to as simple as possible, right? And then say, let me teach my colleague why this problem is important. The best way to learn something is to teach it, right? Because then you start thinking about all the possible questions. Then you start thinking, does this matter? You say it doesn't matter so much. We can leave it out for now. Does this, like for example, my cell phone has a cover to be able to protect it from falling. Does the color of that cover matter? No. It's a nuisance variable. It doesn't matter, right? Similarly, if I have some other feature about the phone, if it's an Android phone, doesn't matter whether it's Samsung or some other company. Android is Android. So all Android phones more or less behave the same. Does it matter what company I purchased the what shop I purchased it from? No, it shouldn't matter. So how do we remove the variables that don't matter, focus on the ones that do, and systematically ask what's the smartest way to solve this problem? So that's how I break it down. That's the engineering mindset. You're in first year, you will learn by the time you're in the fourth year, you will be an expert at this because you will figure out how to break things down to their simplest essence and solve the questions from there. Once you can solve the problem at its simplest essence, then you start making it progressively more complicated. Not overly complicated, just how much is required.
Thank you, sir.
Thank you, Preetham. Thank you, sir. Then next, I would like to call Sneha Sharma to come up with her question.
Sure.
Hello, sir. Very good evening to you.
Good evening.
So, my question to you is what do you think will be the biggest barrier to increase public trust in any AI driven healthcare systems that we provide in the long term vision?
Your question is great, but if you don't mind, can you repeat it one more time so I can fully process the
Yeah,
gravity
sir.
of your question?
My question was what do you personally think that how can we increase public trust if we integrate AI driven healthcare system in hospitals sooner?
So first of all, Sneha, that's a great question. It's a very powerful question. And I think again, like I mentioned, the only way is to not maintain this notion of a halo around the subject. You need to make it simple to understand. Education is the only way, like I said. If somebody is talking to you at a level that says, that they're trying to make it too complex, one shouldn't hesitate from saying, sorry, I don't understand. Explain it to me in a way I can understand. Because if you want me to pay money and buy your product, the least I would expect is I know what it does, right? See, think about it, right? When I go to buy a bottle of water or I go to, buy, chocolate from the store, I am not a cocoa farmer. I don't know anything about how chocolate is made, right? I have never done, I can eat chocolate. That's all I can do. I can't make it, right? But the information on the chocolate bar is enough for me to decide. If you look at the ingredients on the back, if it doesn't have egg, does it not have egg? Does it have too much sugar? Which company is making it? All this information is available to a point that I can make a very educated decision and say, this chocolate bar is good. I'm going to pay this amount of money, buy it and eat it. Some other chocolate bar, you might say, well, it is not perfect by my liking, even though it's a great chocolate bar, and I can decide not to buy it. So, how do we create the level of awareness in people's minds that they can evaluate AI in the same way? The answer to using AI responsibly is simplicity, not complexity. If somebody tries to make things complex and say, believe me, it works, you shouldn't take that on face value. Ask them why, ask them how, right? And if you don't get a good answer, ask someone else. But you should not feel hesitant to ask questions until you are fully convinced and you feel comfortable. So that's the key part is let's keep asking questions. We will learn. Nobody can know everything, but if you are inquisitive mind and you ask the right questions, eventually you will be able to reduce that impediment that you're talking about.
That's a wonderful question, and as such, the answer from Dr. Rao quite interesting, and thank you for that answer, sir. Next,
Sure.
I would like to call Rachit to go ahead with his question. If Rachit is there, he can go ahead with the question. Okay, I would like to call Malesh to ask his question.
Yes, ma'am. I'm Malesh from DIP student from Vidya, and my question is, how can we train ourselves to observe everyday problems in healthcare and turn them into innovative ideas?
It's a great question. So if there are problems that you see that, again, like I said, you need to break them down to their most basic essence. And then you ask, what is wrong with the system, right? What if there's a solution? How should a solution be thought about? Is it a technology solution? Is it an AI solution? Is it an education solution? Is it an awareness solution? Where is the problem in what is currently going on? And how can we use methods to be able to address that problem, right? Some solutions, some problems require a technology solution. Some problems require you to go and educate and make people aware. That's a different solution. So the keenness of observation is to say what is broken and what do we need to do to get to a point where it is better than what it is currently, right? For example, and I will recommend, you should look at Professor Ashok Jhunjhunwala from IIT Madras. He is a very world-renowned figure, very nice person, world-renowned figure who is thinking about frugal engineering. He wants to solve India's hardest problems in the most engineering elegant way, right? Because solving the problem, you don't have to be perfect. But anything, if you reduce the problem from 100 to 50, that's still a big development. One shouldn't shoot for zero because shooting for zero makes you become a perfectionist, and sometimes you might end up overcomplicating or making the problem too expensive. Whereas from going from 100 to 50 might only cost you much less, might be more easy. And then eventually we start iterating as a community until we can get it to as low as possible. Okay, so that's my perspective.
Thank you. Thank you, sir.
Sir,
Next, I would like to call
excuse me, sir.
Aman Chaudhary. Aman Chaudhary will ask his question. Malesh, you can go on mute. Aman Chaudhary. You can ask your question.
Yes, ma'am.
Yes, Aman, please go ahead.
Good evening. Good evening. I am from Vidya West Zone. So my question is, how does our AI project with
How do you start AI project
patient data,
patient data?
privacy?
Okay, so that's a good question. It's a very difficult question. People are still trying to answer. But one way might be to, so there are two ways. One is called anonymization, where people have technologies available to remove all this private information from the patient's data. And they anonymize the data and make it available. That is easier to use. The other is an idea called synthetic data generation, where you can use real data and make a fictitious copy of it. And that fictitious copy doesn't have any patient-related information. And that information can now be shared to use to build AI solutions. So that's one way. The third is some hospitals have put their data already anonymized on the public domain, like on websites, for you to be able to download and build your solutions. So those are some ways.
Thank you, sir. So next, next we have two students coming up with question, and then we will move on to our closing remarks. Before that, Rashmi ma'am would also like to join and share her thoughts. So the next person will be Anuj, who will be asking his question now. Anuj, please go ahead and ask your question.
Good evening, sir. My name is Anuj from Vidya Gyanavardhan program. Thank you, sir, to giving me this opportunity. So my question is, if we are beginners, how can we start using technology as a AI tool to solve real world problem without advanced knowledge?
So I would disagree that you don't have advanced knowledge. You already have the intent to solve a problem. And that's a very powerful motivator. You will learn what you need to do as you make progress. It is nobody waits to accumulate knowledge and then solve a problem. We learn as we work on the problem. For example, if somebody builds an app to do heart rate, as you make mistakes, you realize, oh, the heart rate fidelity is dependent upon the camera, is dependent upon the operating system version. We learn as we go along. So don't wait to accumulate all this knowledge and then wait to solve the problem. I think the biggest sometimes impediment is our own hesitation to start. There's no perfect time to start. The best time to start was yesterday. We can't go to yesterday. So the best time to start is now. Right? And eventually, as you make progress, you will say, okay, I need to learn this thing. I'll go find about that. I need to learn this other thing. And then eventually you get all the pieces that you need. Never underestimate the power of your mind. It's a very powerful place, right? And you already have figured out that you want to solve some important problems. That will talk to your teachers, there are some good resources on the internet. It will show you the way. Don't worry about that. Just get started.
Thank you, Anuj. Thank you, Anuj, for the question, and thank you, sir, for that brilliant answer. And now, finally, we'll go with Shruti Sable. Shruti, please ask your question to sir. Shruti, are you available?
Are you on mute, Shruti? I can't hear you.
Okay. If Shruti is not there, then we have a very enthusiastic young student who wants to ask a question, a very small student, but he wants to ask a question which will definitely enthrall the audience as well as you, sir. So I call upon Samarth to ask his question. Samarth, if you're there, please go ahead with your question.
Hello.
Hello.
Good afternoon, sir.
Hi, Samarth.
Hi, sir. I am from student DP. I want to ask you a question. What if, everyone promotes their works, or a presentation with the positive things, only with advantages. May you know what are the disadvantages and how it will be solved? Like your team and your employees should be ready within a fraction of second if any like what do they say, wait, if a firewall is break down and if third parties enter to it and they get the information, right? So what is the solution for it? Like in a fraction of second it should be solved because others data should be not saved for them.
Yeah.
Yeah, may I know even the disadvantages of this and what are the solution even for it?
So I hope that in today's conversation, I have told you that we have to take a balanced outlook to AI. In fact, I would hope that the message is that we use with caution, use with care. Like any important, if you buy a medicine from the pharmacy store, you use it only when you have a problem. You don't just take it for the sake of taking it. Yeah, you use it with care. And I think the same thing applies is, yes, it's important to be prepared for. That's why you're asking a very important question, Samarth, in that innovating is one part, but making it a product is a very different responsibility, right? Innovating means you can afford to have small mistakes. Everything doesn't have to be perfect, right? You get a proof of concept and it's enough. But the moment you put it on the internet and it touches everybody's lives, the responsibility has gone up exponentially,
Yes, sir.
right? And companies are still, and I think tech companies are still trying to understand that responsibility, because the what you're saying is, I think, a very important value that tech companies need to keep in their vision to ensure that there is no harm to patients. The first thing doctors learn about is first do no harm, right? So when you use it for something like healthcare, you have to be careful that if you can't help the patient, that's one thing, but don't harm them, right?
Yes, sir.
So these are the kind of values that one needs to inject into engineering. That is why I believe the human AI teams are going to be powerful in the next generation, because while an AI can do a lot of things, it needs a human like yourself to inject these value systems and say, no, even if you can make more money by doing this, don't do it, because that's against human values.
Yes, sir.
Right? So whatever questions you're asking, I'm just simply trying to explain to you that, yes, you would like the system to be able to be ready at a fraction of a second to solve these problems. But the first, I think, point we all need to remember is nothing is perfect. Even we are not perfect, right?
Yes, sir.
And
We
I
will
think
accept
humility
it.
to understand that things could be better and we should all be part of the solution is an important component. So humility is something I think that we all need to cultivate and bring into our innovation ecosystem, so that we have the courage to admit that we might be wrong. And because we might be wrong, we have to have the safeguards in place to make sure that we do the right thing for people.
Okay,
I
sir.
hope that helps.
Okay. Thank you.
Thoughtful answer blended with technology, sir. Thank you for that answer and thank you for that question, Samar. Now, I would like to call upon our founder president of Vidya, Mrs. Rashmi Misra, ma'am, to come up and enlighten us with her words and thoughts.
Well, I think we got enlightened today by you, Arvindji. It was wonderful.
Thank you, madam.
How beautifully you represent AI, responsible AI, especially to our children. As you know, the enthusiasm is huge. But I love the examples you gave of the heart and taking the heart rate, and also making them aware that the human person, the mind is more powerful, and using AI as a tool, not just as something that solves your problems. But the fact is that they're very keen, as you saw, very enthusiastic. And what I'd love to hear from you is that they are very keen just not to be consumers, but also contributors to innovation and our children are learning every minute. So we would love to know what ecosystems, what partnerships and strategic priorities you recommend for us for further learning on the similar cause. Could be healthcare, could be responsible AI. You mentioned about this AI for all. That's a wonderful, we will definitely go for that. But then, as you saw, the interest is huge, and we are still learning ourselves as as the Vidya leaders. We would love to see what else we can expose our kids, because this is what their future is, and this is what we want them. They aspire to. They're very curious, and especially on healthcare. So, how do we prepare these young minds to adapt to technology and to shape it in the future? Yeah.
First of all, thank you again for inviting me to be part of this. I've learned so much from the questions. And of course, these are brilliant kids asking great questions. So thank you for that. I will also say that the question that you have raised is a very deep one. I wish I had a good answer. I need to think about it a little bit more. But at the very least, I would say perhaps to understand that if one has to have agency in the world of AI, how does one think about shared responsibility? How does one think about the fact that an AI agent is looking to offer help? But at what point will we be ready to process that sort of help? One of your own students, I spoke to them in Bangalore when I was on site. And the student very beautifully, there are two students actually, both very eloquently said something. One said that, I would rather not use AI because I want to experience the joy of making a mistake.
Fantastic.
Right?
Yes.
And the fact that the mistake is a learning opportunity.
Absolutely.
That was a beautiful thing that the student articulated. The second was the student who said, I have certain goals, I have certain aspirations, and I use YouTube to do this. But it becomes very clear to me that AI is trying to manipulate me to think a certain way. Again, for a student at that young level, I think this was a ninth standard student, for them to have this self-awareness to process that they are being manipulated, I think was fantastic. So I think these aspects of awareness are inherent in these beautiful minds. They already know what to do. But to listen to it and not let the AI drain out that essence is critical. So I think it's in fact a call to be even more human if we can.
Wonderful.
To listen to that, because there's so much of noise out in the world, it drowns out the signal about who we are.
Absolutely.
And every student today has asked questions about how do I work to make the world a better place. Everybody has that fundamental, want and aspiration. I would say listen to that and let that be the guiding light.
Wonderful.
In terms of resources, I need to think a little bit more. Like we said, one of the courses is the course that the government of India is running. And I'm actually very optimistic that after this 1 week workshop on AI in Delhi, that's just concluding, I think, today or tomorrow, I think there'll be some very quick movements on the Ministry of HRD and the Education Department to bring those to our students. I would pay attention to that.
Okay. Let us know if there's anything that you recommend, because as you know, Vidya is also creating a discovery innovation hub, 5-floor, 80,000 square feet center, just to have this skill available to thousands of our children. And maybe it's the future. So many are interested in healthcare, many are interested in many aspects to see how they can be the change for tomorrow. So we need a lot of learning. And thank you so much for guiding us in so many ways by physically being present at Bangalore. How much they've all, what a beautiful teacher you are. You're an excellent teacher.
I appreciate that very much. Thank you.
Thank you, Arvind. And we'll keep in touch with you.
Absolutely.
If you don't mind. Yeah, thank you.
I would love to.
Thank you, dear. Yeah.
Thank you so much, ma'am.
Thank you, Nandini, and of course the audience. Thank you all for your patient listening and for asking good questions.
Yeah. So as we come to the end of today's inspiring session, I would like to take a moment to reflect on the powerful message we have received. Act with integrity, which also aligns with Vidya's policy. Don't procrastinate. AI intervention along with human intervention is the better tomorrow. All these are the wonderful takeaways of today's session. The team Dream, Dare, Do truly came alive through today's talk. So we understood that innovation does not begin in labs alone. It begins in the mind of a curious individual. So it begins with observing the world around us, asking meaningful questions, and having the courage to explore possibilities beyond the obvious. So, throughout the session, from curiosity to innovation, AI in healthcare, we have learned that complex challenges can be broken down into simple, actionable ideas. We have seen how interdisciplinary thinking, combining technology, medicine, data, and human empathy, can create solutions that truly transform lives. Most importantly, our students have understood that innovation is not just limited to experts alone, it is accessible to anyone willing to learn, think critically, and take initiative. On behalf of the entire Vidya family, I extend our heartfelt gratitude to Professor Dr. Arvind Rao for sharing his invaluable insights, experiences, and vision with us, sir. Your time, guidance, and encouragement mean a great deal to our students and our Vidya team. You have not only shared knowledge, but also have instilled confidence and aspiration in young minds. We sincerely thank you for being part of our Dream, Dare, Do series and for motivating our learners to think boldly and act purposefully. Thank you once again, sir. Thank you, dear Rashmi ma'am, for giving us this opportunity to learn. And thank you to all our students and participants for your active engagement. Let us continue to dream big, dare bravely, and most importantly, do consistently. Thank you so much for joining on this special occasion of this Dream Rare Do webinar series. Thank you so much from us.
Thank you so much. Very grateful.
Thank you.
Thank you so much, sir. Thank you so much, sir.
Thank you so much, sir.
Thank you. Thank you, everyone.
Thank you so much, sir.